Hey guys, it's Jordan here, and I'm going to tell you how important, maybe even show you and let you realize how important health screenings are for yourself or your family members. So let's get started. So I think the main thing that I want to harp on is to make sure that you are aware at the end of this video that your health should be top priority. The reason why I say that is I work in a urology office here in Winston-Salem, and I work with buku's amount of male and female, primarily male, and they come in for their regular checkups. A lot of men actually have a referral from their primary care physician because they have a elevated blood test called a PSA. And if you're not familiar with that, PSA is actually your prosthetic or your prostate levels. Now, on a male anatomy, the prostate is actually like an almond shape between the bladder and urethra. And actually, if this is your prostate, right, and your bladder is right here, your prostate is below the bladder. This is your urethra, and it's actually just channeling out through the penis, right? So with that being said, your prostate is an almond shape just kind of surrounding that urethra area. So if that blood test is elevated, it can be a couple things. So one, it might just be because your prostate is enlarged due to prostatitis, which is an infection into your prostate, inflammation. Itis means inflammation. Anytime you see that at the end of any of the medical terms, as well as it also can mean that you might have benign hypertrophy aplasia, which means just benign means negative, but it could be extra growth of your prostate, so it can enlarge and it can protrude into your bladder wall, into the base of your bladder. So that can actually protrude into your bladder and can cause a stricture or like a sphincter almost, where it's tightening that urethra to where you could barely even pee. And sometimes for gentlemen, if they go to use the restroom and they go to pee, sometimes it feels like they still have something that they have to empty, but they are not able to. So that is what we've known as urology, is urinary retention. So urinary retention actually can be female or male. Obviously, prostates are only for male anatomies. But, that is something common that we deal with at my office. And with the prostate cancer screenings that we do the lab work, which is the PSA. And again, most primary care physician offices take care of that. And then if they see that it's elevated outside of the normal range, or there's a family history of prostate cancer, sometimes those physician assistants or those doctors or PCPs, primary care physicians, they will send those results out as well as a referral to our office so that those patients can be treated accordingly. Now, you're probably wondering, what is a normal level for a PSA lab test? And I'll tell you. So a normal level is about 0.0 to a 4.0. Now, give or take, depending on, again, your age, your health in itself, your family history, and any symptoms which goes along with health that you have might differ or make a difference on if you need to have further treatment, or if they think that we're just going to sit here and surveillance is what they like to call it, just to keep a watch on things. I've had some patients that will have to just do blood work and they'll be fine. Sometimes the doctors will go ahead and do a rectal exam, and most men, I know, do not like that. But in my case, in my office that I see, a lot of men end up getting those, and it actually sometimes even saves their life. And you're probably thinking that is way too dramatic to be actually saying just to do a rectal exam for a doctor can tell if he can see if that will save someone's life or not. But sometimes it will. Because if you haven't had a blood test before and you just have that rectal exam, those doctors, sometimes just the feel or the touch of that prostate, if it's hard, if it's soft, if it has a lump, or, different things like that, they can tell just with that quick rectal exam. I always encourage any gentleman, I think it's around the age of 40 or 50 and up is usually when they do those rectal exams. I always encourage them to let your pride down and do not sit here and go past the time that you can get that checked. Because I've seen it time and time again where patients have yet to have it checked whether they have prostate cancer in their family and have that history there, or whether they don't and they have just simple side effects or even no symptoms at all. And when they come to our office, sometimes they end up having prostate cancer. So it is very, very important to be mindful of your health, be mindful of the symptoms that you have, even if it seems like it's just one little thing that you feel like, oh my gosh, it's nothing, right? If it continues to progress, if you're having symptoms such as urinary retention where you can't go to the bathroom or you feel like you're not emptying enough, right? If you're having incontinence sometimes where you're dribbling on yourself when you pull your underwear up and you see you're dribbling because you still haven't finished, right? Or where you end up peeing on yourself and not even meaning to. And sometimes, again, you just don't have symptoms at all. Just get on a routine to where you ask your physician, when is the best time and when do I need to start checking my prostate level, my PSA? Just so that you are taking the utmost care of your body and your health. I always encourage, if someone is younger than the normal age of getting a rectal exam, sometimes you can also catch, most of the time they catch cancer with just the PSA lab test. But, such as a friend of mine, his dad, his grandpa, and his maternal grandfather had prostate issues and prostate cancer on one side, but in general, all three of those gentlemen in his life had prostate issues. Talking with the doctors, it's still important for him to follow up. You just don't want something to creep up on you out of nowhere, and then all of a sudden, you get some news that you didn't really expect. So I encourage you to inform, if it's not you as females, right? But you as a male, I encourage you guys to be up to date on your health. And it don't even have to be prostate cancer and checking for prostate cancer. It don't even have to be for that. In general, don't let something pass you by because of your pride, and don't let something pass you by because you have no issues or you have no symptoms. Just when you do your regular screening each year for your health exam, if you go, which you got to get there first, but if you go and get regular blood work, do your regular workup, because, something can change in the flip of a hat. And let me tell you, I've had multiple patients come in my office to see our surgeons, and as me being one of the nursing staff and just being there on the sidelines, just watching the patients get news that they did not expect just from doing a simple procedure. It's called a cystoscopy. We talked about it in my previous videos. But watching them look on that camera and seeing, the prostate being enlarged and protruding through that bladder, like we mentioned, you could see before. Or, again, sometimes just there's bladder cancer in there, or you might have a stone in there, kidney stone, nothing too dramatic, but still something there, right? But the point of what I'm trying to say is, don't sit here and think that you are inevitable to get sick, because it is possible. I pray and hope that you do not, but, we're not invincible. We can get sick, and things can happen, and sometimes when we least expect it, whether we least feel any symptoms, I want you to understand that that should be your most top priority, is your health. Whether it is eating well, whether it's exercising, whether it's drinking water, like I mentioned in my last video, and how much you're supposed to drink. Because you get dehydrated, you're not getting your skin to be cleaned because you are not drinking enough water. All these things matter about your health. And just doing those simple blood tests sometimes, you're just doing those simple exams that makes you feel uncomfortable. As long as you are doing your steps that you need to do, you could keep up with what's new and growing in your body. And you could be like, oh, I could stop that right then because it's small and it's not to a point where it's unmanageable. Get to that. Be thankful that you have a great health, and just continue and push on and not sit here and let it go by you. And if you don't have a great health, then find those surgeons or those doctors, or, some people look toward God as their great physician. I know I do, but you have to be mindful that you need to take care of yourself before it gets too late. That's all I have for you today, and I hope that maybe you will take something from this and realize that something can happen of a flip of a switch, and hopefully you take care of that before it happens. Y'all have a great day. Thanks.